So whenever we are doing a large volume enema, we first want to just verify the order of what we're going to be doing, and then you want to identify your patient, and then you want to just explain the procedure to the patient of what you're doing, why you're doing it. That way they kind of just know the basics of what's happening. If they have any questions, you're there to answer them. So first thing that you want to do is you want to go ahead and just get your equipment assembled, get your table to the right working height that you need, and then just go ahead and close the curtain and have all your equipment ready to go. So first thing you want to do is you want to go ahead and warm your enema solution. You can do it like in a microwave, or if you just happen to have like warmer tap water, just go ahead and feel, or you just have warmer water. You can go ahead and do that and just feel it against your skin to make sure that it's a good temperature. And then you want to add the solution to the container. And once you do that, you want to go ahead and release that clamp and allow the fluid to process through the tube before you reclamp it. So then you want to go ahead and adjust the bed to a comfortable working height for you as well. Or you can go ahead and do this ahead of time if you'd like, but it's fine. But whenever you do this, go ahead and just make sure the patient is in the Sims position on their lateral side, left side, and you want to make sure that you just have access to the anal and rectum. So once you get there, you just want to go ahead and put on your gloves, and you want to go ahead and just elevate the solution that you're going to be having. You want to have it at, I'm pretty sure it is no higher than 18 inches, but you can put it on an IV pole. Make sure it's above the patient, and you want to give this for about 5 to 10 minute intervals. And then you want to go ahead and just lubricate the end of your little tube for the enema, and you just want to lubricate about the first 2 to 3 inches of that tube. Then you want to go ahead and continue to get access into the anus by lifting up the buttocks, and then you want to just slowly insert the enema in the tube. Yeah, actually, insert the enema into the anus about 3 to 4 inches, and then you just want to slowly do that. And over a period of 5 to 10 minutes, you just want to slowly add the solution. And if you happen to have any symptoms of like pain or anything crazy, or any type of like lightheadedness, nausea, dizziness, anything that person seems like maybe they're vagling, go ahead and just stop the procedure and just monitor the patient and make sure that they're okay. Once you get all through that, you want to go ahead and just clamp your tubing and lower the container. That way if the patient has to defecate or use the bathroom or anything. Once the solution's been given, you want to clamp your tubing, and you want to go ahead and just remove the tubing out of the anus. And whenever you do this, make sure you have necessary tools around to clean up any messes or any type of discharge that could happen to come out afterwards. Then once you do that, you want to go ahead and just return your patient to a nice comfortable position and have them retain the fluid for about 15 minutes would be nice. Make sure their linens are dry, and make sure like their bed is dry and that they're comfortable. You don't want to leave them in a moist environment. That's how you can create pressure injuries. Then you want to go ahead and just raise the side rail up, get your patient's bed back into a safe position. And whenever you're done, go ahead and remove your PPE, wash your hands, and you're done with the procedure.